Well, All Search is a Papua New Guinea company. It's one of, if not the largest Papua New Guinea company. Its future is absolutely tied to the future of Papua New Guinea and its people. And we have around 2,500 people generally working for us. And when they're in the field, obviously we need to look after their health, the chemistry of health, but also their physical health, the total health program, which is diet, exercise, and a balance of work-life balance, if you like. In the community, we do health programs primarily to get to know our community and give something back. We've built over the years a range of expertise in malaria, more recently HIV, AIDS management, child maternal health, etc. And to get to know our community and work with the community, the crying needs that they have are some basic health care. And if you do want to work with them, and we do, it's fundamental to our operating stability in the field that we do work with them. Getting them involved in employment, in education, in training is part of it, but also providing fundamental health care. Well, obviously these programs don't occur overnight, and it's taken a while for us to recruit the people, to get the right expertise for the conditions that we work in Papua New Guinea. And really we saw not just a need in our own project areas, we saw a need for these sorts of services across the country. And to do that effectively, clearly All Search is doing that primarily with its partners, funding it itself and providing the expertise, the support structures to make it all work and deliver. And with successful results, a real strong desire to move some of those projects around the rest of the country. But of course we have, like everybody, a relatively limited pool of resources, including money and people. And we did look towards forming relationships with people like Global Fund, AusAid, ADB, and a range of other potential donors to provide those services effectively and efficiently, expanding outside our core operational areas. And the Health Foundation, the All Search Health Foundation, provides us with the platform to do that and to progressively build it outside our core business, but as part and supported by our core business, and allow, shall we say, a more independent view and a more focused view on community issues and community service, and forming a private-public partnership with a range of other donor agencies and partners that I think provides the right transparency and the right process to actually make a difference. And that's why the foundation was formed. Well, the Health Foundation, as you say, is a non-profit organisation, a charitable organisation. And it's drawn the expertise, the core expertise, out of our core company operations in terms of the specialists that provide malaria management, HIV/AIDS management, child community health, etc. Those people have now been moved into the foundation. We've also provided a range of access to systems and processes which will help the foundation. And now it's up to the foundation to build on the relationships we have with people like Global Fund to actually expand and deliver the projects that we've undertaken to do and are looking to, as I say, expand into. But the project, the foundation itself is a platform which is independent, transparent, a charitable organisation outside All Search core business, which we think provides the best mechanism to deliver these programs in a predictable way. The foundation will only work with good, true partnerships, and clearly having a public company involved in these sorts of things, even through the foundation, does represent a new way of doing business with people like Global Fund, people like donor agencies, churches, etc. We think it's a model that will be, I think, very successful, leveraging the strengths of the private sector and our skills in All Search with the various strengths and experiences that come from Global Fund. And I must highlight the National Department of Health. Predictable outcomes, delivery against targets is what we hopefully can bring and can demonstrate with the Health Foundation, working with the public sector and a range of donor agencies to provide that they're getting bang for their buck and making a difference on the coalface out in the villages in Papua New Guinea. Our commitment to the country is substantial. We've been in country since 1929, and we anticipate being in country for many, many years to come. So our commitment to not just our own shareholders and delivery of what we need to do in terms of business is very strong, but our commitment to the Health Foundation goes along with that. This is not a short-term issue. This is a very long-term commitment that the company is making to make a difference in Papua New Guinea. And with our future, frankly, quite rosy in Papua New Guinea, we anticipate that the foundation is part of our core commitment to the country. Our core commitment to like-minded partners is to be there for the long haul. And we will be there for the long haul.